Okay. Hello, everyone. It's April 24th. It's our briefing today. We've got several things to go over. The first thing that is always the toughest for me is announcing, and I think we should always do this in the most respectful way, but announcing we've lost a couple more people. We now have a total of 31 deaths in West Virginia. The last death was an 84-year-old lady in Jackson County. I'm not ever going to get to where talking about this becomes just a statistic. I've said it many times, and I'll continue to say it. All these individuals are moms and dads or sons or daughters or whatever of somebody. They all have a name, they all have a family, they all have loved ones and great friends and everything, and this terrible disease that has run rampant across this country and this world has taken its toll. So please keep these people in your thoughts and prayers always. I think the number one thing that beyond that we need to discuss is just this, is everybody is yearning towards how we're going to move and transition and keep this balancing act going and transition to how are we going to reopen? How are we going to get the engine running again? Is the engine going to run differently than it has in the past? And it will have to run differently until really the bottom line is until we come up with a vaccine that enables us to be able to go back to the way we were, which all of us want to be able to do. But we're a good ways away from a vaccine, and hopefully what can happen is we can transition with drugs that diminish the severity of this disease, and maybe we can use them to diminish the severity, meaning we can take it from a life-threatening thing in most cases to a really bad type of cold, and then move that and let that bridge us to our vaccines. But what are we going to do in West Virginia? And I've promised you just this, that we're going to have real live plans of what to do. But as we go forward, we're not going to run and cannonball in the middle of the pool and then awaken to the fact that the pool didn't have any water in it and we've got a real severe problem. We're going to try every way we possibly can to protect you and move forward. Now, I'm going to outline a few things here today and everything of things that we're considering and we're moving. I've told you before that this is a 35-piece puzzle. And I really truly believe that I know maybe 32 of the 35 pieces, but nobody knows all the pieces. And by nobody, I mean nobody, because this thing is constantly fluid and constantly moving, and that's why we're dealing with a pandemic that no one in all of our lifetimes has ever dealt with before. But as we move forward, the first thing we're going to do is what we've already announced. We've got to get our hospitals up and running. We've got to get our elective procedures back into our hospitals to where our hospitals have a lifeblood to be able to really move forward. Now, we're doing that right now behind the scenes with all of our hospitals and working towards the fact that next week, we'll be able to roll out and go to work with our hospitals. Now, so that in itself is going to be a major move from the standpoint of the economics of our state, because I think, there's in excess of 25% of the impact, the economic impact of our state lies somewhere in our healthcare industry. So with all of that, the next component to that is just this. You've got a lot of people that are working at those hospitals as throughout our state that need daycare. And so the component right behind that is we want to get all of our daycare facilities. Now, some of them are closed and some of them are still open, but we want to get all of our daycare facilities up and running again. To do that, we're going to make it mandatory that there be testing to all the daycare staff, so that when you bring your children there, you'll know that component of it is safe, and we're going to do ongoing testing to the daycare staff and try to come up with even ways that we could, and we're trying to go through the wickets to see what we can legally do and everything, to where maybe we could do some temperature testing on kids or whatever like that, or temperature testing on parents or whatever that would be coming into the daycare facility, and so, to drop their kids off. But we'll get to that as we move on down the road. Now, a big concern that we have that is going to hold us back, but we hope it's not going to hold us back an undue amount of time. But a big concern we have that all states have had forever is the amount of PPE we've got, the amount of general supplies that we have, the amount of masks that we have, the amount of all those things that we have, because no matter how many we have, it's not enough. And we've made requests, we're searching the world all the time. We're buying stuff from everywhere, and we're going through, and we've done that really, really well. And I commend all those that have worked on that countless hours and everything. But just like everyone, we're still short. And so as we move forward and we move into a situation to where at our businesses or the possibility of our restaurants or whatever it may be, we need additional masks, or we need additional equipment and everything, or need additional testing, abilities and everything. It is an ongoing situation that will allow us to monitor how fast we're able to move forward, because we're not going to move forward if we don't have the right backup behind us. We're not going to advance the soldiers if we don't have the artillery and everything to take care of those soldiers and absolutely have all the other ingredients that we have to be able to take care of the soldiers. So now, I do want to report a couple other things that go hand in hand with getting us back to work. We have had a lot of dialogue with a lot of different businesses, and we continue to have all kinds of that dialogue, and that's what we need to have. One of the sectors is our manufacturing sector. And something that would be kind of unbeknownst to a lot of everyday West Virginians is that almost 95% of our manufacturing sector in this state has continued to work and is continuing to do good stuff. Now, we need to really brag on those people and all that as how they've gone about doing that. There's businesses that have taken the doorknobs off all the doors to where you move in and out of doors by just touching them with your elbow and everything. There's businesses that have social distanced and everything. The manufacturing sector needs to be commended in many, many ways, because they have continued to keep West Virginia running in lots of ways, and done it in a really safe manner, and we commend them in every way possible. The other thing is just this: if you look at the economic impact of what's going on, there's no question that as the numbers continue to flow in, the numbers will be negatively impacted. But up until just a few days ago, the negative impact of our revenue numbers was not all that bad. And so the net of what I'm saying is we have many, many, many people that are working in West Virginia today that we declared as essentials, and they continued to work. And so from the standpoint of us being like totally shut down and now we've got to try to build our way back, we kept a lot of people working through the time period, and we did it in a prudent way, because look at the numbers. Look at the number of positives. Look at the number of deaths and everything compared to our neighbors, and they've been really good. Now, I want to go one step further and keep on moving, just moving along on this. As we encourage, outdoor activities for West Virginians. We tried to restrict, from the standpoint of people coming across our borders and coming to our state parks and infecting us and bringing bad stuff in from New York or New Jersey or wherever it may be. And we did that, in a really good way. We continue to try to tell you as West Virginians, and you've done this already, you have absolutely enjoyed the benefit of our state parks and just in this incredible landscape that we have. Enjoyed that with your kids. I mean, the opening day of the youth turkey season, was a big bump to the upside. There's things that you're already doing that's really good. We're going to look at the next step. One of the next steps, we're going to look at opening up the outdoor dining at our, and giving you the ability to be able to do that, and that'll be rolled out real soon. In addition to that, we're looking at, and Jordan, if you could put that slide up that shows West Virginia and shows the hot spots and everything, could you do that, please? You don't have that? Okay. All right, well, basically, it shows a hot spot in the Morgantown area, a hot spot in the Eastern Panhandle, a hot spot over on the western part of our state in the Cabell, Jackson, Wayne, and all that. But that's somewhat slanted because of the nursing home situation right there and everything, and a little bit of a hot spot up in the Northern Panhandle. But the overwhelming majority of our state, pretty solid and pretty good shape. Now, we can look at two different ways to go here. From the standpoint of our restaurants, if we were to open up a lot of our restaurants as we start to move forward and everything, that give you the ability to go and feel safe and everything as you move into that stage. And that stage is probably, 7 to 10 to 14 days away, provided things continue with the trends and everything moving as they should. But when, just to give you some level of protocol that we would be working with our restaurant owners and everything on, and this is just a 80,000 foot flyby, but just a little bit of a protocol. But we'd be looking at limiting capacity of our restaurants to maybe 50%. Having protocols where there would be all kinds of cleaning going on of surfaces, limiting the number of people that would be at tables, doing temperature checks for employees and protocol to deal with sick employees, having all kinds of masks and everything for our, cashiers or buffets and all that, having disposable menus or disposable utensils, serving all the beverages in cans instead of in glasses and all that. And doing a special, spacing and everything at any access to any kind of bar or anything that would be related to the restaurant. But there's things like that we're looking at, but they're still a little ways away. And we're very hopeful to be able to give you more and more freedoms of where you can move and everything in a safe and prudent way. Now, the net of this whole thing is just this. As we continue to go forward, we're going to move you along as best we possibly can in as safe a manner as we possibly can do. We've all got to realize just this. We all want to go back to work, but none of us are going to go along with putting you in a situation and rushing you back into a situation that we feel like is not the prudent thing to do from the standpoint of your health and being able to protect you. The last thing on earth we've got to always remember is just one thing, and that is just this. West Virginia is the most highest risk state of all. West Virginia has the most elderly, has the most chronic ill, and from the standpoint of diabetes and obesity and a lot of the things that can make this disease really tough. And West Virginia is absolutely within a rock's throw of 2/3 of the population of this country. And so with all the border counties and everything, West Virginia is exposed. We've got to be safe. We've got to do the right things as we move forward. If we do, we'll move forward and we'll run across this finish line just like we already have. And we've done it, and we've done it, and we've done it as West Virginians. And you've pitched almost a perfect game. Now, we don't want to blow it now and have everything blow up around our feet. Now, so you see the things we're doing. We're encouraging more outdoor activities. We're going to open up the outdoor dining as soon as we possibly can. We're going to move absolutely very aggressively towards, having all of our elective procedures and opening up our hospitals. Right behind that, we're going to test all of our daycares and try to bring all of our daycares up. We're absolutely consulting with all different types of businesses to where we can relax things and let businesses go back to functioning with employees on the job. But there are so many aspects to this that we are going to monitor, and we're going to absolutely crawl before we run. Now, I want to just go through a few more announcements, and let me say one last thing in regard to that. As we roll out Monday and Tuesday, we will roll out more definitive things. The thing that we're trying to do now this is where threading the needle is, or the balancing act is really tough. But things are so complex that it is difficult for us to understand as just citizens of our great state as what's the right thing to do and what's the wrong thing to do. We're trying to simplify it to where we can take those baby steps and monitor those baby steps to keep you safe. And so we'll be rolling out a whole lot more stuff at the first of next week. Now, we have an executive order, that Morgan County was in the hotspot area of the Eastern Panhandle, and we're lifting the executive order on Morgan County, because their number of cases is not moving hardly at all. They wanted to be involved because of their borders in the D.C. area and all that kind of stuff, but really and truly, we're removing that executive order with Morgan County. I want to remind everyone that as of 10 o'clock tonight, as far as the self-employed and independent contractors to go online and start registering for your unemployment benefits. Just some more quick announcements. We do have one positive at our corrections facilities. It was our first positive. It was a correctional officer that's been self-quarantined. He quarantined himself as of the 15th of April when his wife alerted him that she had been exposed to the virus. DHHR has concluded that no further action at the facility is required as the result of the officer's responsible actions, and there is no risk to the facility or inmates as a result of this case. I guess the last thing that I've got is just this, our prisoners and our National Guard are working together with our corrections people, and they're doing really neat stuff. Our inmates at the Lakin Correctional Center, is making all kinds of masks and everything. As at Denmark Correctional Center, the Charleston Correctional Center inmates are doing the same thing. These numbers are 600, 500, and everything. And I want to really thank Secretary Sandy and just all the different people on all the staff and everything for all the great stuff they're doing, along with the National Guard. It's really amazing, how many people have stepped up in so many different walks of life and everything to do really good stuff. So just another couple of things that I'm just trying to look at my notes and see that I've missed. As far as opening up, from the standpoint of the possibility of our restaurants as we go forward and all that, I would tell you that we'll give the restaurants plenty of notice as to when that's going to happen, because they have to have, they probably have to have, 7 days or whatever to get food and everything all lined up and make preparations for what they're going to be able to do or not be able to do. And let me see if there's, I guess there's, a notice that I have here is there's one positive at our Sharp Hospital. Is that correct? And they have been self-quarantined as well, and we're monitoring that situation. So I think we're good there too. The only other thing that I would bring up is just this: is I keep reemphasizing we absolutely want to come back to work, but we want to make sure that we do not have a backlash, and we will not put you back to work or put things open that will expose you if we're not prepared on the backside with the necessary equipment and everything, from the testing to be able to get to the hot spot, to the beds, to be able to treat, to be able to squash out any problem that would arise. And we're not going to put you out in a situation to where we think that we're going to end up with a backlash and a surge come back on us. And so we're going to absolutely continue to move in a prudent manner. There's no way on this earth that I'm going to do anything that I feel like is going to expose you unduly. And so with that all being said, the only thing I would say is we're going to have to move this thing along, and I'm sorry that I've taken so long, but we're going to have to move this thing along today because I've got a 12:30 call with the president and the vice president that we've got to be on, and our healthcare people need to be on the call as well. So that's all I've got. And now I think what we're going to do in order to be able to give our media people and people that are wanting to ask questions more time, we're going to move directly to that.
Yeah, thank you, Governor. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Charles Young with WV News.
Hi, this is Charles Young, WV News. Governor, could you be a little bit more specific about the timeline for opening the daycare facilities? Is this supposed to coincide with the resumption of elective medical procedures on Monday? How long would it take to get this testing done to get the daycares back open?
Well, Charles, here's what we want to do. We want to bring the daycare facilities back up just as quickly as we possibly can. We're going to move towards doing that immediately, from the standpoint of right behind or right in conjunction with testing all the nursing homes. We're going to get right on that and everything to be able to bring that up as quickly as we possibly can, to where that it will coincide to some degree with how we bring, how we're able to bring our hospitals back up. So we're, they won't overlap completely, but we're moving on that right now.
Okay, thanks, Charles. Next, we'll go to Amanda Barron with WSAZ.
Two questions. First, is the nursing home testing complete? I know today was the goal day for that. And then also, are there certain benchmarks that the state will put in place as far as how much PPE the state has before those restaurants or other entities can open? Is there a way that you guys are going to quantify that, or will it just be a moving target?
Well, Amanda, first of all, I'm going to let our general answer the first question, but before he goes, I'm going to answer the second question. We've got not a forever ways to go, but we've got a significant ways to go in assimilating the proper PPE and all the stuff before we can move to the restaurant level. But that is not weeks and weeks away, but it is surely a significant amount of days away, because we've got to secure a great deal more supplies than we have right now. But anyway, the general can answer the first question.
Amanda, testing is ongoing through the weekend and probably the first couple of days of next week. I believe Secretary Crouch may have an update on the actual number of facilities that we have completed to date. Bill, do you have those numbers?
Yes, I do. Yes, I do have. In fact, I received an update while the governor was talking. We've actually completed 83 nursing homes in the state. That's 2/3 of our facilities. We have another 12 scheduled through this weekend and are in contact with the remaining facilities to get those tested as well. So we're moving very quickly. We have thousands of tests that are pending that should be coming in the next few days. So Monday, our numbers will ramp up very quickly.
That's good. That's really good.
Okay, next we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. There was a recent study by Moody's Analytical examining the stress testing of state budgets, and it was specifically about coping with the coronavirus. This study by Moody's Analytical suggested that for West Virginia, there may be an estimated effect on the general revenue fund of more than $1 billion. What we heard most recently from your administration was maybe $500 million in effect. But earlier in this news conference, you referred to some recent numbers that may have looked not as good. So I wonder if there's an update on what the financial effects for West Virginia are looking like right now.
No, Brad, if I indicated that, I indicated it wrongly, but because what I was trying to say was just this, that the revenue numbers, the numbers have been trending better than what we have thought up until the last 2 or 3 days. And the numbers the last 2 or 3 days were probably numbers that we would have expected, 2 or 3 weeks ago. And so really and truly, I think in general, we're better shape than we really thought we were going to be. But at the same time, I don't want to paint a picture that's too rosy, that really and truly, we're still concerned, that the numbers have to go down. I mean, that's all there is to it because of what all is going on. But I truly believe that we're going to have a backfill from the federal government. I really believe that that everything from the standpoint of the economics of the state is going to be fine.
All right, thanks, Brad. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Thank you. I have a question for General Hoyer, if possible. Generally speaking, the Guard has been out now throughout the state, working, delivering meals, and doing all the things you report every day, with more than 700 troops now that are activated and working. Do you have any numbers on any Guard members who have exhibited symptoms or tested positive for COVID-19? And I know that you go into very protective gear and procedures whenever you're testing, but how about when the Guard members are just out in the community doing a little less stringent, medically mandated tasks, but still in communication and in contact with a lot of people?
Yeah, Kenny, so a couple of things related to that. Number one, all of the 700 members who are involved in this, and in addition to that, all of the full-time members of the Guard who are continuing to work to do our military mission are doing medical surveillance and monitoring every day. That's health questions as well as temperatures and other activities. We have had, and we maintain a roster daily of the total number of Guardsmen that we've had to put into quarantine and manage them to ensure that they don't come up with the COVID issues. At the high point, we had about 300 Guardsmen across our 6,400 who were in some level of quarantine. Today, in the briefing I received this morning, we're down to 34. I don't have the numbers on if we've had, I think we may have had 2 positive individuals, but I'll get those numbers for you. Holly will get you those numbers. But we have done an exceptional job, in my opinion, on the medical surveillance and the monitoring, and that's kept our health of force where it needs to be. We actually are monitoring a group of individuals right now that the governor and I will be talking to tomorrow who are actually deploying out of West Virginia to go do their military mission overseas. So we've done an exceptional job, and I appreciate the work of our medical staff in that regard.
Okay, thanks, Kenny. Next, we'll go to Taylor Stuck with the Herald Dispatch.
Hi, Hi, yeah, this is Taylor with the Herald Dispatch. Governor, you talked about PPE. We need more PPE. But I was wondering, will it be the responsibility of, say, restaurant owners and other small business owners to get those supplies that they need when they start to reopen, or will the government be able to provide some assistance in that regard? Do you think that our market for like hand sanitizer and Clorox wipes has kind of rebounded for that to be able to move forward?
What did she say in regard to rebound?
The question was regarding PPE and the availability for restaurants and others.
I got that.
Cleaning supplies are the other thing, because are we going to help provide cleaning supplies for them?
Okay. All right, Taylor. Let me just say this: that I think if you were, in all of our polling and everything with the restaurant owners, here's basically the feedback that we're getting in general. The restaurant owners would gladly purchase their own stuff. They're struggling with the cleaning supplies that they can't get the cleaning supplies, because you can't find them and get them at Walmart or whatever like that. From the standpoint of the mask, they're having issues or things that they may need like that. They're having issues with that because they just can't get them and everything. So what we're trying to do is find a methodology to where we can secure enough to where we can supply them with the masks that they need, and either we're going to foot that bill, or they'll gladly foot that bill, because that's not the issue of who's paying for it right now. The issue is just the availability to be able to get it. So we're working that very diligently, and that's one of the things that's going to hold us back. And until we can satisfy that need, we surely can't move forward, and there's many other things to consider too, from the standpoint of just where we are and where we want to go. We're watching every aspect of every place. I mean, just think about this. We're looking at we sure don't want to get out on a limb and be as absurd as I think Georgia is trying to be, because Georgia has left even following the guidelines of where our president wants us to go. And our president absolutely wants to put this engine back to running. And so, so we're watching everybody from the standpoint of soliciting information from the federal government, to watching what our bordering states are doing, to watching what everyone is doing. But at the same time, we're listening to our experts that we have, because we got some really smart cookies and everything that are working this and have absolutely made the right move. So we really don't need to be listening to a lot of people from the outside. We need to be listening an awful lot to the people that have gotten us where we've gotten us to.
Okay, thanks, Taylor. Next, we'll go to Mark Curtis with Nexstar Media.
Mark Curtis with Nexstar Media here. Governor, opening up daycare is a pretty broad stroke, because every single industry and place of business and employee sector in this country depends on daycare. Yet the only things you're talking about reopening right now are hospitals and outdoor restaurants. Are you considering a broader reopening soon, so that maybe small shops that aren't in malls or hair salons and haircut places and other places that are standalone businesses can also open too, to take advantage of the possibility that their workers can get daycare?
Well, Mark, you went really broad right there. I mean, when you get into, hair salons and barbershops and things like this, where people are right in the face of their clients and everything, that's way down the trail as far as I'm concerned, and way down the trail is a little bit more insignificant, But as far as opening the daycares and then broadening beyond the hospitals and everything, we want to broaden beyond the hospitals, and we want to continue to just move forward and everything. As I've said over and over and over, only move forward as we crawl before we walk and walk before we run.
All right, thanks, Mark. Next, we'll go to Steve Adams with Ogden.
Yeah, Steve Adams of Ogden Newspapers here. Still hearing anecdotally, I know that we've cleared the backlog in applications that were on hand for unemployment, but still hearing anecdotally about people that call daily or try to call daily into workforce. And I know we've tripled the staff and we got 3 call centers, but have repeatedly called every day and still can't get through. And in relation to that, the Tax Foundation shows that West Virginia ranks 41st in the nation in regards to how many weeks of unemployment benefits our trust fund can cover. And that's based on 2020 fund solvency and continuing claims as of April 18th. And on top of that, they also rank us 42nd as far as solvency of the state's unemployment insurance fund. So what are we still doing to try to help these people that don't even have an application in? And also, how solvent is our unemployment insurance trust fund to be able to handle these additional claims?
Stephen, let me answer the first part. This is the second, and I always, you see me react so many different times to this. But when I get somebody to ask me a question 2 times, I want to get an answer right now. And so if there's still people that are calling and there's nobody answering the phone and everything, I'll promise you we'll rectify that today. But I can tell you we tripled the force and then we tripled the force again. And as far as the solvency of being able to pay the unemployment claims, I think, and my general counsel is sitting here right now, making notes and telling me that we'll be able to tap federal dollars for the unemployment and everything. And I don't think that's an issue as far as the solvency whatsoever.
Okay, next we'll go to Annie Moore with.
Okay, so you're asking all the daycares to reopen, but if not everyone's going back to work, how do you keep those daycares financially solvent?
Well, Annie, that's a real issue on everything because, you're tapping on something right there that is exactly, part of the problem rather than part of the solution or vice versa. And it's just this is you can go out and you can say, ABC, company, we think you're okay to go back to work. But the company doesn't think maybe that they're okay to go back to work. And so therefore the people don't go back to work. And so therefore it trickles right into the daycare situation. And so I think what we've got to do is ask our daycares for feedback from them and everything as they go forward, and to ask them, that we're standing in the wings, willing to try to help in every way we possibly can to assist and make sure that we don't put them in a situation to where that they're risking the solvency of their daycare facility and the workers and the economics of running their daycare.
Okay, thanks, Andy. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, yesterday you said that the potential for corruption with voting by mail is rampant. Do you have evidence of that, or is that just a Trump talk?
No, Phil, I think just this, I'm not an expert on elections by any stretch or, of the imagination, but I think throughout time, we have had evidences of the fact that that voting, in a basically controlled way, can expose us and has the potential of exposure. And I don't have specifics. All I have is a whole lot of information that people have given me from the standpoint of nightmares that can happen and bad things that can happen that way. We know when people roll into the polls and everything and vote, that it's the fairest and the best way and the least way to expose us to any level of corruption.
All right, thanks, Phil. Next, we'll go to David Beard with the Dominion Post.
Hi. Today, Senator Maroney sent you, the governor, a letter that was signed by President Carmichael and some other senators suggesting that we create a kind of a reopening advisory council that would be in addition to your team you have. I don't know if you'd seen that and if that you would consider that something worthwhile even considering.
Well, I've not seen it yet and everything of what you're saying, but we've already done this. We're doing it, and we're looking at doing additional steps. As far as additional task forces or advisory councils, we're working on that nonstop. So we've been way ahead of that curve, and we're working that with everybody all the time.
All right, thanks, David. Let's go now to Anthony Izaguirre with the AP.
Governor, is there a clear set of testing, PPE availability, and contact tracing criteria that you want the state to meet as part of your reopening strategy?
I think I've got to pass that to our experts, and I can pass it to Dr. Marsh and to General Hoyer. But let both of them comment on that, because I'm gonna move forward with what they tell me to do on that.
So maybe I'll start. Anthony, thank you for the question. So as you rightly point out, part of the roadmap for reopening America from the White House Coronavirus Task Force is about creating sufficient PPE, and the governor has talked about that both for the healthcare industry but also for the commercial industry, looking at expanded testing, and also looking at number of cases going down over 2 weeks, and then having active surveillance. Certainly, as we go forward, we are actively, as we have mentioned, expanding our testing capabilities. The fact that we'll have tested all of the nursing homes for the executive order from the governor, which will basically match the number of people we have tested up to this point, is evidence of our expanded capacity for testing. We were just on a call last night with the Centers for Disease Control, the White House, and FEMA, talking about augmenting our surveillance strategies. We are expanding our teams and our capabilities. We are targeting the areas of our state that have the most activity and looking at the most vulnerable populations. As we talked about before, we are now looking to bring on board a digital surveillance capability that we will bring to the state and the state's residents in the near future.
I'll just highlight a couple of additional items. We have a group that works daily with the Hospital Association, the folks in the long-term care industry, and we're balancing the PPE requirements as we work to this phase to reopen to some types of elective procedures. We've been working with them on demand and throughput requirements, so that's looked at on a regular basis. And then as we look at the different sectors in the phases, as the governor pointed out, we'll have to look at what private sector entities can get PPE, ones that we will have to work with to address those needs. And as Dr. Marsh pointed out, we're continuing to robust the capability for the epidemiology and the surveillance piece going forward as we look at those activities. So we manage each of those that you highlighted each day, and as the governor points out, those are fluid each day as we move forward.
All right, Governor, I will turn it back to you.
Well, I guess we've got to run, and we've got to go to this conference with the Vice President and the President. But I would just say this, West Virginia, you've entrusted me to protect you in a really, really tough time. And I've surely tried to do that with your cooperation and with all these experts that we've had around us, and they're really smart people, and they've done a great job in everything. And as we move forward beyond this, I would just promise you with all my soul just this, that I'll continue with these experts to try to protect you in every way, and I will try every way in my power to be able to get you back to work and get you back to a lifestyle that you've become accustomed to, and we'll try to go together as we run across this finish line with this terrible disease and move forward with our lives. And we're going to win this battle, but we've got to do it prudently, and we've got to do the right thing from the standpoint of your safety and all of our safety. So God bless you, and let's get at it, and we're going to win this thing. Thank you.